My research is broadly defined is looking at the factors for risk and resilience for people's health and well-being. And obviously gratitude is one of those factors. I think one of the reasons I've looked a lot to studying gratitude in the context of chronic illness is when you live with a chronic health condition or a chronic illness, such as something like heart disease or diabetes or arthritis, a variety of other conditions that people struggle with, it puts sort of a constant stress on you. And some of the early benefits that came out from about gratitude were that it was beneficial for reducing stress. And so if you've got individuals who are in a context who are daily experiencing ups and downs due to the symptoms they experience as a result of their condition, they may be in pain, they may be fatigued, they may have limitations to the things they'd like to do because of their illness. If some of the research we were looking at and that was coming out was suggesting that people who were grateful in those conditions were faring much better than those who weren't experiencing gratitude. And when I say experiencing gratitude, I mean on a regular basis. So one way to look at gratitude is not just a state. So when someone does something nice for you, you thank them and you have a state of gratitude. You have that sort of nice warm feeling, those positive feelings, and you feel grateful. But we also talk about having a grateful mindset or having a grateful orientation. And these are people who have just developed a way of dealing with life and looking at life that allows them to more easily and readily notice and appreciate the positive. So the research we looked at was these people that had this sort of grateful mindset. And what we found, one of the first studies that we did looking at this over time was two different chronic health conditions, arthritis and inflammatory bowel disease. And we found in both of those illness groups, individuals who had a more grateful mindset 6 months later had lower levels of depression and better overall well-being. And so you might go, okay, there's lots of other factors that could contribute to depression and well-being. It's not just about gratitude. So we actually tested a very rigorous model where we controlled for their depression at time one, other stressors, fatigue, illness variables. I mean, we threw pretty much everything into that model that we could have. And I remember at the time that we were running the models, I thought, oh, this is just going to wipe out any effects of gratitude, because there's other factors that are explaining why we're seeing this association with gratitude and better well-being in these individuals who are struggling with their chronic health condition. And what amazed me was that nothing wiped out the effect of gratitude. It stood on its own, distinct from everything else, and was a very powerful, the amount of what we call variance, or the amount that it explained in the outcomes, was not huge, but it was stable. And when you're living with a chronic health condition, any little thing that can improve your well-being is valuable. So that's one of the I think more remarkable studies we've done that really to me just brought in to highlight the power of gratitude and what it can do, especially for people who are under such stressful conditions.